Okay. Well, colic is a general term that both parents and healthcare professionals use to talk about babies that have long crying episodes for really no apparent physical reason. There's lots of different definitions of it. One that's commonly used is crying that lasts in the baby for greater than 3 hours per day, greater than 3 days a week, and some people will say lasting longer than 3 weeks, but most of the time most parents are going to consult a healthcare professional before it gets to the 3-week point. There's a lot of theories, and there's not a whole lot of research to back up any one particular theory, but some of them include intolerance to milk protein, a lactose intolerance, a food sensitivity or an allergy to something in the mother's breast milk, something that the mother is eating. It could be caused from an immature gastrointestinal system. Could be caused by different feeding techniques. Some studies have shown that there's a possible increased incidence of colic with exposure to tobacco smoke. Another theory is that it's just some babies are hypersensitive. So there's a lot of different theories out there, and unfortunately there's no one good answer at this time. The onset is usually between 2 and 4 weeks of age, and then it can last up until about 3 months. They say about 60% of babies who have colic, it will disappear by 3 months, and then about 90% of babies who have colic, it will disappear by 4 months. And there's really no particular risk factors for colic, interestingly enough. It happens equally in male and female babies. It happens equally in breastfed and bottle-fed babies. It happens equally between full-term and preterm babies, and sibling order also does not make a difference. If you think your baby has colic or is going through long periods of crying and you're not sure what to do, make sure you do talk to your baby's healthcare provider. Another very important thing to do is that babies with colic, it can be very stressful on the parents. Having a newborn in and of itself is very stressful, even for a baby that doesn't have colic, but when a baby does have colic, it can be very high stress for the parents as well as the family unit. Make sure that you take a break from the baby if you need to. You want to make sure if you're ever feeling very frustrated and like you could hurt the baby, put the baby in a safe place, such as his or her crib, and walk away and call for help.